we're almost done with the semester. The last section we need to learn is about the nervous system, and within that is are the cranial nerves. So I've got my MacBook pulled up, and I've got the famous notebook. So I have like all the stuff, and I have the list of the cranial nerves. There's 12 of them. So I feel like I'm just gonna go through them one by one, and this is mainly like to help me remember it. So I might like repeat stuff, or like, I don't know, like I'm legitimately studying right now and you're gonna help me. Okay, so first we have cranial nerve 1. So I have 12 of them done. So the first one is cranial nerve 1. So we're gonna start with cranial nerve number 1, and this is the one I keep stumbling on because I keep wanting to say optic, but it's not. It's the olfactory nerve. So it has to do with your smell. Now, if this were a real cranial nerve exam, first thing I would have to do is, before the exam officially begins, I have to like take note of if the patient, aka you, is alert and aware and like oriented. So let me take a quick look at you. Patient alert. Oh, and I gotta put today's date. July 17th. Yep. Patient is alert. What is your first and last name? Okay. Then your date of birth. Alright. So today we're going to be performing a cranial nerve exam. Fun fact, I have actually had a cranial nerve exam before. Back when I had like some like damage like in my skin, or like what I perceived to be damaged. So I was sitting there and I was like, oh my gosh, this is a cranial nerve exam. But anyways, okay. So yes, you were conscious, and it says following a logical order. I feel like that's subjective, so we're just gonna go in order. Anyways, cranial nerve number 1. That is the olfactory nerve. It is a sensory nerve, because there's 2 types. There's sensory and there's motor. Sensory meaning that it takes information in, like sensory information in and up to the central nervous system, the brain, I think. Yeah. And then motor meaning that it has to do with movement of some sort. Not too much on me. I learned these like literally 3 days ago. Alright, so it mainly has to do with smell. And the Google page says to use common non-irritating odors. So you have to close your eyes. Close your eyes. And I'm going to give you 2 scents, and you're actually supposed to use each nostril individually. Okay, so plug your right nostril. Alright, let me smell it first. Don't look. Alright, wait to open your eyes when I tell you to. Alright. Oh. Alright, now switch nostrils, so do your left. Okay, and let me write that down. Alright, you can open your eyes now. What did you smell? Alright, yes, that was vanilla extract. Okay, and that is your cranial nerve 1, olfactory. And let's do one more. Alright, so this next one, go ahead and close your eyes again. this one up. Okay. Alright, now plug your nostril. Alright. What? No, wait, don't tell me. Alright, now plug the other one. Alright. Go ahead and open your eyes. And what did you smell? Yes, it was instant coffee. Good job. This is it. Okay. What do we have? Okay. So that's it for cranial nerve 1, olfactory. So now we're moving on to cranial nerve number 2. And that is your optic nerve. Well, let me get my visual aid ready for you. Okay. Cranial nerve number 2. It's your optic nerve. It is a sensory nerve, and it has to do with your vision. Duh. Okay. So for that, I have to assess your visual acuity using a Snellen chart. Your visual fields and your pupillary response to light. Okay, so let's do the Snellen chart first. And then if I'm not mistaken, I think that's the eye chart. So, alright, optic nerve. Optic nerve, and that's cranial nerve number 2. And for this, we are going to use this little chopstick. You see Billy in the back. Okay. I'm so paranoid about my mic. Let me check it. Okay. So, here, oh yeah, look at that. Snellen pocket eye chart. Look at me. Okay. Okay, optic nerve. So, you know how this goes. Go ahead and cover one of your eyes. Alright, go ahead and read the top for me. Good job. Alright. Now, this one. This one. Good job. This one. This one. And this one. This one. This one. Good job. Good job. This line is usually where I tap out. I have horrible vision. Alright, you want to go one more? Okay. Alright, I think you're good. Now go ahead and cover up your other eye. Good job. And we are going to start again from the top. Good job. Good job. Yep. Yep. You want to be bold and go for one more? Look at you. Awesome boss. Okay. One. Alright, and that all looks normal. Let me go ahead and jot that down. So that was cranial nerve 2, your optic nerve. Oh wait. Okay. Visual fields. Okay, and pupillary response delay. Okay. Ooh, I'm getting ahead of myself. So we did the Snellen. right. Okay, yeah. Okay. So for this one, you have to look at my nose, or you can look at the bridge of my nose, whatever. Okay. And then don't move your head, just look at my nose. I'm going to bring fingers in, and you're gonna tell me when you can see them. Okay? Alright, you ready? Alright, look at my nose. Alright. Okay. 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 Alright. So now I'm going to start in the center, and I may go this way or that way. You just tell me when you can't see my fingers anymore. Remember, just look at my nose. Okay. Good. Okay. All right. Looks good. So that was the confrontation. Oh, and then pupillary response to light. All right, I have my handy dandy pin light. Bright light warning. Okay. All right. Look at my nose. Okay. Good. Good. Looks good. All right. That is it for your optic nerve. All right. So the next three are your eye gets a lot of cranial nerves specifically for it. Your eye gets four in total cranial nerves just focused on itself. Like, I mean, not itself, like, you know, the eye, I guess. Okay. So assess your eye movements, extraocular eye movements in 6 cardinal directions: convergence and pupillary response. So I already did that. Okay. So I learned today that your eye has smooth muscle, which is involuntary, you can't control it, as well as skeletal muscle. So skeletal muscle is muscle you can control that's attached to a bone. So let me go ahead, and then we have that separate, and then cranial nerve 6, and that is the abducens. So yeah, that abducts the eye, so lateral. Okay. So you're gonna go right here. I don't want to mess up my order. Okay. So all 6 cardinal. Okay. So go ahead and look over there for me. Just checking the your extraocular eye movements. Okay, look that way. Beautiful. All right, look up. Beautiful. Look down. All right. That's up, down, left, right. 6 cardinal. Left, right. What other directions could there be? Well, let's look it up. 6 cardinal direction of eye. What? So up and right. So we did up and right. We did, well, no, so up and right. So you'd be going that way. And then right. Then down and right. Down and left. Left, up and left. I feel like that's more than, but whatever. So that's cranial nerves 3, 4, and 6. normal function. Okay. Alright, so next we have the trigeminal nerve. And it's called the trigeminal nerve because it has, I think, like 3 heads or points. Yeah, 3 branches. 3 branches, and that's cranial nerve 5. So it's sensory and motor. So I have it's for touch, pain, temperature of face, and then for motor, it deals with your chewing muscles like your masseter, your maxilla, right? Your buccinator, I think. Okay. Oh. The dull item will just be the back end of this chopstick and the sharp end will be this toothpick. Okay, so nothing that can actually hurt you. Alright, so go ahead and close your eyes again. And we'll do a couple rounds of sharp or dull. Okay. Close your eyes. Sharp or dull? Good job. Sharp or dull? Good job. Where are you at? Sharp or dull? And we can barely. Sharp or dull? Sharp or dull? Good job. Sharp or dull? Sharp or dull? Sharp or dull? Alright, a couple more. Sharp or dull? And last one. Sharp or dull? Awesome work. Alright. And that covered your cranial nerve 5, your trigeminal nerve. We're almost halfway done. Cranial nerve 5. Alright, good. Alright, now 6 is your facial nerve. And this is the easiest one. You just got to make a couple of bunny faces for me. So first, I need you to smile. You don't have to show teeth if you don't want to. All right, and frown. Good job. Raise your eyebrows. Good job. Puff out your cheeks. Good job. All right. Everything checks out there. That was your cranial nerve 6, facial nerve. I mean, not 6, Lord. 7. 6 was your abducens, so cranial nerve 7, facial nerve. Because I have a couple of them memorized, and that's one of them that I had memorized pretty well. So, okay. Until now. All right. So now let's do your vestibulocochlear. And that is cranial nerve 8. We talked about this one a lot in lecture today. Okay, so vestibulocochlear, that has to do with your hearing as well as your balance. Hearing and balance. That's why they tell you don't put Q-tips in your ears, because if you poke it too far, you can rupture your tympanic membrane or your eardrum, and it can like lead to problems. So, okay. So we already did 6. That was your, 7. That was your facial nerve. All right. And now we're doing 8, vestibulocochlear nerve. That's sensory. And there are 2 nerves merged together. So cranial nerve number 8, vestibulocochlear. And how we remember it is cochlea is in the ear. So for that, we have to do a whisper test and a tuning fork. I don't have the tuning fork, so we are going to use something else. Close your eyes and tell me which direction the following sound is coming from. All right, one more time. Yes, and that is my mini singing bowl. And quick little whisper test. Close your eyes again. And I'm going to give you a series of words, and you are going to repeat them to me. Are you ready? All right, first set of words. Television. Flag. Octopus. All right, go ahead and repeat that. Good job. All right, close your eyes again. Close them. All right, second series of words. Leggings. Market. Pizza. Good job. All right, that is it for your vestibulocochlear. So the next cranial nerves 9 and 10 are in a pair. 9 is the glossopharyngeal. So glosso having to do with the tongue, pharynx having to do with like the throat, and then the vagus nerve. And the vagus nerve is a big deal because it is the longest cranial nerve, and it's called the wandering nerve because it travels down into the thoracic and abdominal cavities. It deals with taste and swallowing via your pharyngeal muscles. So go ahead and swallow for me, and let me, is it okay if I touch your throat? Okay, I'm gonna just position my hands. All right, go ahead and swallow. All right, and one more for me. All right, and no like pain or any difficulty swallowing, no coughing it back up or anything like that. All right, good. And so pharyngeal, cranial nerve 9 looks good. All right, so now I got to do your vagus nerve. Well, the vagus nerve does much more than that, but there's nothing else to do for that. Okay, so that looks good too. And the vagus nerve is cranial nerve number 10. All right, 2 more. All right, cranial nerve 11. That is the accessory or the spinal accessory. Go ahead and shrug your shoulders up to your ears. I'm going to take my hands and try to push your shoulders down. Try to stop me, okay? All right, shrug. All right, good job. And now I gotta test your sternocleidomastoid, which is like this long muscle that goes here and originates on your sternum. So, all right. So I'm gonna push on top of your head, not really hard, and you're gonna turn side to side. Okay, you're gonna try to resist me, but not too hard, or you might hurt yourself. Okay. All right. Pushing down. Go ahead and try to turn. Good job. And that is your spinal accessory, cranial nerve 11. And we do a shoulder shrug. And we're testing sternocleidomastoid. Last but certainly not least, we have the cranial nerve 12. 12, and that is the hypoglossal. And if you're not studying anatomy, this makes no sense, and that's fine. You should be asleep by now anyway. So I have to test your tongue movement. So you're going to protrude it. So side to side, and strength. I don't really know how you would test tongue strength, so I'm gonna pull out the tongue depressor, aka chopstick, stick your tongue out, and I'm gonna try to push it down, I guess. All right, that's it. So that was the cranial nerve exam practice to help me learn the cranial nerves. Thank you for letting me practice.